Beautiful. All right. Welcome, Dr. Anna.
Thank you. It's great to be here, Catherine. Happy to be here.
Yes, I'm really glad to have you. So we're here today to speak about Julva. I want to just introduce myself briefly. I'm the founder of Embodied Women, and Dr. Anna and I have known each other for a few years now, and I've interviewed you many times. And I'll let you introduce yourself and what you're doing. But this is an exciting project that I found out about when I first interviewed you about 3 years ago now. And so I was really excited when I found out a few months ago that your dream of creating this particular product had come true. And so I'm really excited to let as many women know about this as possible. So I'll let you take it from here.
Wonderful, wonderful. And I know there were some questions that came in, so excited to be able to answer those questions and any others that come up. So I am an Emory University trained gynecologist and obstetrician. I retired my clinical practice a few years back. And one of the needs that so many women have struggled with has been dryness, the issues of dryness, loss of pleasure, loss of lubrication, all the things that can happen. That so many women all the things that can happen when we age. And then there's the other issues that happen that we see often as a gynecologist, including, prolapse, incontinence, even hemorrhoids and other areas down with our nether parts, right? Our little feminine bits there that can suffer over time, and women suffer silently. For the most part, we suffer silently. It's not something we talk about, and it's something that carries some, definitely negative self-talk with it. As well as just a sense of limitations. For example, the woman who's exercising regularly but starts to leak is going to limit her activity and change that up. And it's a consequence for most of us. And I've surveyed women, over 75% of women have issues with our feminine bits, whether it's dryness, lack of pleasure. And we may feel like, okay, I love my partner, but what's going on? This doesn't feel right. And worse, really what's worse is that often this dryness, this lack of lubrication, lack of ability to experience pleasure with our spouse really creates this kind of loss of, definitely loss of intimacy in the relationship. And that's really tragic. And I always tell women, you're not to blame. I mean, if you have pain every time you have sex, why would you want to have sex, for instance? And it's a very real common, but it's more than that, and something we don't talk about. It's the discharge after, it's discomfort after the fact. And many women feel like they just have to power through, but there is negative feedback to that. It makes us want less intimacy, and we really are designed for that. And it's an important part of our relationships, no matter how old we are. So I think this is really important. I created Julva, so a feminine cream, feminine anti-aging cream for our lady bits. And it's been getting great reviews. I've done the science. I've worked in with women's health for over 2 decades, over 20 years. And I'm just passionate about creating natural solutions for women that are responsible. And this has been great. This has been so rewarding to hear back from women all around the world that are just getting tremendous results. One woman said it was the missing piece in her puzzle. And I like that.
It's fantastic. It was the other thing about it is I have a lot of people writing me and just saying, wow, this is so great. I'm going to try this right away. And one of the things that I've seen in people of my I'm 58, so people generally of my generation, is there's often a lot of embarrassment and shame when it comes to dealing. As long as they're kind of working the way they should, we don't talk about it. We don't really explore. We don't really know what this part of our body is about. And one of the things that really, a big realization I had is, we worry about our hearts, we worry about our lungs, we think about, keeping our digestion healthy, but we don't think of our genitals as a necessary organ. It's as part of, we don't really think of these lady bits, as you're saying, as organs in our bodies that need to be consciously taken care of. And so as a result, a lot of times I see what you were describing is this kind of, well, it's not working. I'm just not, okay, it's shut down. I'm not going to have sex anymore, or it's not, or, you kind of, it's a little bit like you can kind of try to ignore it. So anything that empowers us to understand, this part of our body as an integral part of our health and well-being, that it's flourishing and its nourishment is central to who we are as women. Anything that can promote that, I feel is a wonderful thing. And this is such a practical product.
Mm.
It's really so easy to use as well. And I was thrilled. I got my sample in the mail a few months ago, and I started using it, and I was amazed at immediately. Like, I had done a lot of other natural approaches to lubrication, and because I had started to feel that dryness, and I had done a lot of things to say fix that, and they were working pretty good. But there was still, it was like I just felt this kind of sluggishness, like I'm not really responding in the way that I want to be, in the way that I feel like I want to respond. And that's where I felt a really big difference with this. It was like even more lubrication, but also more quick to respond to the sensuality and the sexuality that I feel I have in me, and that gets excited up from outside me as well, but more easy to respond to that, less of a feeling of worry and anxiety, like, do I have any of that feeling left? And so I found that was really the first thing, like, happened really quickly, that didn't even have to wait for that.
Yeah, and I've heard that from so many women, and I agree. I would like to make the argument that our lady bits are more important for elasticity and moisture than it is to worry about the wrinkles around our eyes, right, or around our lips, right? We do, but we need to pay extra attention to our lady bits, because the consequences as time goes on are really, can be really devastating, can be really harmful. And so like I always say, ounce prevention's worth a pound of cure. And this is that, but also with clients who have been, like, I have one client, she's in her 70s using it and sexually active weekly. And it's like, yes, this makes a difference. And she just says that it's just part of the rekindling that we've missed and are so happy to have that again. And that's an important part. The other thing is women, we shoulder a lot, we bury a lot, and we, take, you mentioned things that we focus on, and we have to make sure everyone else is taken care of around us, right? Our children, our spouse, all these pieces to the puzzle tend to come before us, but that is not okay. The flight attendant statement, put your oxygen mask on first. Absolutely. We have to stay as that, centered, energized, grounded individual, and really make sure that we're taking care of ourselves as well, so that we can best take care of those around us, and those around us can better take care of themselves through our example. And that's key. Where men are concerned too, like they're not afraid to talk about Viagra, Cialis, and the list goes on, right? No concerns. But for women, it's been much more taboo, and it doesn't need to be. What we need to emphasize is that, rekindling our relationships, rekindling our, there's so many levels to that, right? There's so many levels to that, but this one aspect can be can be really key to help people reconnect, stay connected, and just for ourselves, for that powerful oxytocin connection that our bodies crave and we need, and is such an anti-aging longevity factor, right?
Right, exactly. Well, I know that some people wanted to dig into some of the nitty gritty things about, because this is a DHEA based product. And just, again, my own personal experience over the years, from the time I was a teenager till now, is that I don't respond very well to hormones of any kind added to, what I do. So I've had to really try some natural approaches, but I found that I didn't have any negative side effects from this at all. And so I thought maybe you could explain to the people. I know we have Kate joined us on Facebook, and I know there's people that are going to come on later also, but just for the people who are listening now and going to be listening, how is the DHA hold up against some things like estrase and some of the other things that women use, to help with vaginal atrophy and that kind of thing?
Yeah, no, that's a great question. So DHEA, dehydroepiandrosterone, is a bioidentical hormone, really. It's over the counter in the United States. We have it over the counter. It's been generally recognized as safe. Supplement, again, caution. I always say a little bit is great, too much. You don't need too much, you don't need too little, right? There's a balance in there. So the idea of putting DHEA came in through research, working with women in prescribing vaginal hormones, which are only by prescription. No vaginal products all vaginal products are under a drug classification. So testosterone, estrogen are prescription, and though that has worked, testosterone has worked to help build muscle, help with incontinence vaginally, and DHEA as well. The research has shown great safety studies. There's now a DHEA vaginal suppository that's available just this year with called Intrarosa, which is a 6.5 milligram vaginal DHEA suppository. But up to this time, there's been a decade of research looking at DHEA in women and the safety profiles, even in clients who have had breast cancer, not on tamoxifen, but other clients who have had breast cancer. And we're looking at that because for all this time, for decades now, it's been taboo for any women to have anything to help them with vaginal dryness other than KY jelly. And it just is nauseating when you think about it. It's a shame because it's not helping the tissue at all. It's not, moisturizing. It's not improving elasticity. It's not, doing those anti-aging things that we need it to do too. Right. So there's that issue. But, so I wanted to create a topical cream that is formulated pH balanced and emollient and able to be used on the vulva from, the entire perineum, top to bottom, right? And that is easily absorbed, goes right in. Because I've prescribed suppositories, they leak out, they're messy to use. And I always say, if I'm not going to do it myself, it's really hard to expect other people to do it, but those are great options for sure. And then under physician guidance, using those modalities is hugely important. So with Julva, so standing for joyful vulva, but someone said, oh, I thought you meant juicy vulva. I'm like, that works too. So the way to remember the name, but it's was formulated just to be applied topically, let it go in, let the nutrients just sink in and really do a good job moisturizing the area for sure. And we are getting great results, but DHEA applied topically has been shown to be very, very safe. And again, a little bit goes a long way. Most women will apply the Julva daily for, just a half of an ml. And that's under 10 milligrams of DHEA, and half of a ml daily for the first 30 days. And most women will just do it 5 days a week after that, some more, some less. It really depends on what you're starting with and how well your body absorbs, responds to it. So I think that those are some key benefits of using this formula. Now, DHEA specifically taken orally doesn't have an effect on the perineum at all, it seems. And the same issue, long-term with estrogen. Estrogen vaginally definitely does help with moisture, but it has limitations too. The research, certainly has shown limitations in other factors using vaginal estrogen, but also there's always the concern of using estrogen in women who've had breast cancer, although the research doesn't imply an increase in risk factor at all. It's still a general consensus of fear or concern. So This has been just to make it accessible to women, because otherwise, there's very few options available to women right now that exist. And it's an area that we want to create something natural that you can use, that's safe to use. And I would say, tastes good, smells good, that's important too. It's really important. And so just keeping those aspects in mind as we create something for women, that's really works to be a solution.
Yeah. Now, my understanding from previous interviews that we've done and things is that things like the estrace will help with the surface of the, like the vaginal atrophy. It will help with dryness to a certain extent. But the important thing about the DHEA is, and I'll talk about my experience a little bit to back this up, but my understanding is that it actually helps with the musculature, and that you're actually strengthening on a deeper level with the DHEA. And that's, so I know that I years ago, I had my first experience of that, incontinence, but in regards to, I was running. I hadn't run for a long time, and I started running, and I was like, whoa, what is happening here? Or getting on a trampoline, things like that. So I immediately looked things up, and I did some exercises, and I started to get it. I noticed as I got into menopause and postmenopause, I was like, wow, it's very touchy, this thing. It's like, if I don't stay right on it, it's like I end up in that territory where I'm afraid, am I going to have some leakage here when I sneeze or cough or whatever. So the other thing that I noticed with the DHEA is, on top of I was already doing these exercises and kind of doing good maintenance, but this definitely added a whole nother level of support, that I just felt this confidence, like, oh, okay, I'm hitting it in this area too, and it's helping. So maybe
that's great.
a little bit more about that.
Yeah, and that's very true. And what we are finding with Julva from our people that are using it is that certainly Julva with pelvic floor exercises, we're getting tremendous relief of incontinence symptoms. So, and I do on my website show the correct way to do Kegels and pelvic floor exercises, and there's some discussion of what exercises to avoid that create intra-abdominal pressure that just going to weaken the pelvic floor. So we want to, address those aspects too, and strengthen every muscle in our body as we grow older, etc. So, but the research, definitely with vaginal testosterone and vaginal DHA shows that there is an increase in all three layers of the vaginal wall. With estrogen, it's the mucosal layer, the inner lining, like if we were to look at the inner lining of our mouth, right? But we want all the muscles to be strong. And so androgens help with that factor. And so while DHEA is a precursor to testosterone and estrogen, topically, there may be a small amount of conversion, but we're not detecting it significantly in the serum currently with the topical, topically with Julva. But again, we haven't researched it in depth. We need to do more research, but in other studies looking at vaginal DHEA and testosterone hasn't shown increased elevated amounts of those.
Right. And so I think the cool thing about a cream like this is you can definitely moderate and adjust how much you use very easily.
Exactly. And I think that's the benefit. I always say my clients are smart, right? I mean, like when I was in practice, I would prescribe formulas, but I wanted my clients to be able to adjust them, to tweak them a little bit here, a little bit there as needed. I mean, we're smart. It's not one size fits all medicine. One size fits all medicine doesn't seem to work that well. And so really being able to adjust it to our own needs is important.
It's fantastic. Yeah, exactly. So the ease of use part I wanted to just highlight here as well, because in my experience, it's like it's just an amazing, the quality of this product as well is pretty cool. I mean, I like the feel of it a lot, and it's not because I've used coconut oil in the past, right? Coconut oil is oily, and it doesn't really do what this does. It's a good stopgap in this way, but I was like, oh my God, this stuff is amazing. And it's just the silkiness of it, but also you need such a small amount. And you said something in the last interview that we did, which was like, what would it be like if we were as careful about the quality of our skin around our vulva and vagina and everything as we were around the wrinkles around our face, like you said earlier. And that really struck me so much. And so there's a kind of pleasure I feel just in being able to enjoy taking care. It's like my evening ritual. It's like, this is okay, I'm going to take care of this part of my body now. I put my face cream on, I put my neck cream on, and now I'm going to put my vulva cream on. Just something about it just really lands for me. And I find this consciousness around it too is a big part of enjoying our bodies, you know, including all parts of it. You know, it's
Yeah, and you're absolutely right. Not taboo, needs the tender loving care that it so deserves, right? And it's important for the long haul. I love that. I think that's great.
So I guess I know there was a few questions that came. One of the questions that I didn't send you was around a woman who's kind of, I think she's even postmenopause, and she was asking about how does this affect, you know, like, because she felt like it really woke up that she wasn't sure if this was the cause, but she really woke up the whole menstruation again, and she had like this response of having a small period. And she said, so she wanted to know more about just how does the DHA affect, like if you're in perimenopause or menopause, have you heard of people having, you know, having noticing an effect on the way the cycles are coming and things like that?
Well, it can definitely, just from my, decades of using estrogen vaginal cream, etc. with clients, it can awaken a cycle. Typically it's one, a cleansing, or even, using vaginal progesterone, etc. So whenever we're using hormones, or if we have a change, or we're taking an herbal supplement, and there's a noted change, you can have a breakthrough bleed or a cycle. Now, as a gynecologist, I always take that opportunity to work that up and make sure, like with a pelvic or vaginal ultrasound, and just look at the endometrial lining, make sure that it's not thickened, and so to triage any problems with the uterus at that time. But typically it's not, it's just a response, a response to using something. And then again, a small amount of DHEA will convert to testosterone and estrogen. So that may be part of the effect, but DHEA alone doesn't appear to have any risk. And the research is showing no increased risk in endometrial issues or concerns at all. And so that's really, again, very beneficial. So we want to see that. Now, again, my experience as a gynecologist using progesterone in women in perimenopause and menopause is critical to help stabilize that endometrial lining and keep it from causing us problems from estrogen dominance, if that's what's been going on. So this may, one, just trigger a slight endometrial response. You might have a breakthrough bleed. Number two, you may have some estrogen dominance that your body's been dealing with, and adding some progesterone on board could really benefit you in that aspect. So that's a great thing. And typically it won't return again after that one time, or that, depending in the perimenopause, menopause, not quite completely post-menopause, you may just start to just waken up your HPA axis, hypothalamic pituitary adrenal gonadal axis. You may wake that up, and that's not necessarily a bad thing, but definitely I would always check in with your gynecologist to just do a pelvic ultrasound and make sure there's anything going on there. Do you need an endometrial biopsy? What's been brewing in advance,
Yeah, exactly. So wouldn't be caused by that, but in the sense of there might be a catalyst there, a catalyst effect. Yes, and that's true, like you said, with a lot of different hormones you could be taking, not just
supplements. Yeah.
Yeah, exactly.
Yeah.
So I don't know if you had a chance to look at those other questions at all.
Yeah, let's go through them. I've got them here. So the first question is, my question is about Julva. I want to try it, but my DHEA is pretty high already. I just had a Dutch test and total DHEA production is 1738. I think Julva is a DHEA-based product. Will it raise my level too much? Will it even help me if I already have high enough DHEA and still have the dryness? If this is my experience from clients who have had dryness and who've had DHEAs, I mean, typically I like to see a woman's DHEAS in the serum at, 200, around 200, 100 to 300 range. So I'm not sure how that compares with this Dutch test number. However, in women, even with, healthy upper limit normal DHEA respond well to using topically the Julva. It makes a difference in their dryness. So applying it here has been a benefit. Definitely would follow up, but I think it will not further increase the DHEA, but don't have research on that. I think it's just something to keep an eye on. And, but using DHEA, using Julva topically, again, it's a small amount, but using it topically on the vulva should help with some of the dryness that you're experiencing. So I think that's...
I was just going to ask you a question. So with these samples that you are, that we're offering to people who want to try this, that I'm assuming that's enough for somebody like this person to try that out, and then to know enough in that, week-long period, or however long it takes to use up that sample to figure out if this is helping or not.
Yeah. So it's hard to say with that, because I usually say, give it, the first 7-night trial. Some women amazingly were getting tons of great feedback from that, and a really good response. Women going on to purchase the Julva tube and try it and keep going with it. I typically say in anything, give it 6 to 8 weeks. Right? Give it 6 to 8 weeks. So you definitely want to give it 6 to 8 weeks. And note that, I am just so excited to get the word out that we're offering your audience the free trial, the 7-night travel size of Julva for free. And also note that our tube of Julva is only $69.95, and that's a 2-month supply. I mean, that is economical. I'm keeping it this way as long as I'm able to, but that's tremendously economical. I mean, y'all know how much we pay for an eye cream, right? So, and this is so much more important than that. So, and again, the research behind it and it's huge. So I want to just encourage women to, really give it the time needed, but within the 7-night trial, you can find out how well your body responds to it and reacts to it. And we've got a great frequently asked question page at julva.com/FAQ. That is very, very helpful to answer many, many questions. So
that's wonderful. It's really great.
Yeah. And so let me go with the second question, or you want to read it?
Let's see. No, you can go ahead and read it out.
Okay. It says, I'm 62, re-experiencing much hormonal imbalance problems due to health problems in general. I'm wondering specifically if this cream might reopen my VJJ, which has shrunk to the point that exams are impossible. Also, are there any contraindications to using Julva? So let me answer that one first. I do not recommend it, and I would call it a contraindication to women currently using tamoxifen. Any woman with breast cancer should definitely consult their doctor. I've published research on our frequently asked question page, plus on drAnnaCabeca.com regarding breast cancer issues and DHEA. So again, the research has shown favorable. There's preliminary studies out and more to come. But definitely talk with your physician. That's always really important when you've had a medical condition like cancer. Now, we have had amazing feedback from women who have gone into their GYN where they used to dread the pap smear, right? The dreadful pap. And I know I'm one of those GYNs always using the small speculum and lots of lubrication, but still, it can get so tender and so shrunken that it's really a not pleasant experience to have done. However, we are getting great results back from clients and their gynecologists saying, what are you doing? This is amazing. And patients were like, are you done already? I mean, really, I'm a woman too. And that's something, that's something you would like to be able to say, has it been done? That was quick. Wasn't uncomfortable, wasn't painful, and that's a big shift. So yes. I would expect that you would feel a tremendous improvement with that. And then the third question is, thank you. I do the estrase cream 2 times a week, or it gets severely dry, itchy, and the doctor sees the discharge where the dead, dry skin is dying. So in other words, most likely a yellowish discharge. We call that atrophic vaginitis. if you've heard that terms or you've seen that on your pap smear result. And it said, I've been wanting to try Julva, but concerned if it would work for me. I would definitely say it's worth a try. We had a client, I spoke with her on the phone actually the other day, Catherine, about this very issue. She was having going to the gynecologist regularly for a yellowish discharge that wouldn't seem to go away. And then just after a little while, after using Julva, it did go away. So I was super excited to hear that. Again, sometimes it just requires, the right combination of ingredients to work. And that's what I think makes Julva certainly different, is that it's a great combination of good natural ingredients that works. That works.
Now, in terms of someone like her, would she continue using the estrase, or would she try discontinuing and then try the DHA on its own?
I typically tell clients not to discontinue any medication without their doctor's approval, right? That's like always the case. And we have many clients that continue to use both.
Great. That's amazing. That sounds really incredible. So I know that it took quite a while for you to come up with an over-the-counter version of this particular product. And one of the things that you noticed, we're sort of coming back to like the pelvic care, because a lot of people don't start using this until they feel like they have a problem. Right. And so I know that's how you first discovered. There's a lot of people who were having problems and needing surgery, for incontinence and things like that. And so you were helping them with this, and then they found, whoa, I don't need the surgery anymore, which is amazing. I think that's just incredible. What I wanted to ask you, though, is in terms of prevention, because that's where I find a lot of the things that I do as a health coach are all about prevention. It's like, why wait till something gets so bad and you're in so much pain or so much, frustration, that then you have to like work so much harder to get yourself well again. So would you recommend this as a preventative thing in terms of, so maybe women are starting to experience some of these things, but they're not like so bad that they're causing a major disruption. Would you start using the Julva then, or would you wait until things were worse?
Yeah, definitely would start using it sooner rather than later. Because, it's always harder to come back from, a long sabbatical than it is a short sabbatical, right? And then just balance is key. And so in those cases, and just depending, we have clients that just use it PRN prior to intercourse, just to, if they're having just early decrease in libido, decrease in orgasm, that this may give them a little boost, which we hear quite often. And then just using it on a PRN basis, and then there's also the issue of preventative. Now, I haven't studied this out long term, but I do suspect that it will make a difference.
Mm-hmm. Right. And there's basically, I feel like it's like, again, if we just think about how we think about our faces, we're not waiting until, we have big saggy wrinkles. Most of us are like, hey, at first sign, we're like slathering on the stuff, to make sure that we're trying to prevent those wrinkles. And so I would use the same kind of analogy to say, hey, let's have the same proactive kind of stance and position when it comes to our genitals and just all our female organs. Is let's do whatever we can to keep those babies in gear, and functioning properly.
Yeah, that's the right way to think. In general, that's the right way to think. That what we need to do now, what's going to keep us on the healthiest path possible.
Yeah, exactly. So now I'm going to have a link. I'm going to put a link up on, this Facebook Live so people can get to this offer. But I'd really like you to describe what the offer for people who just want to try this. So it's risk-free. I just wanted you to describe that to everyone.
Yeah, absolutely. And so this offer is a 7-night trial of Julva, completely free, except for we do charge shipping and handling. So there's the shipping and handling. So $4.95 for that, to cover that cost a little bit. Now, it is available in the United States. Unfortunately, we don't have that available internationally. you can get the trial size for international, but I'd encourage getting the full tube of Julva. So Julva in 7-night trial size, it comes in this cute little packet. And it's even actually over a little bit over 7 nights, right? It's definitely a good 7 nights. And just request you use a half of an ml, just a pea size or really a dime size amount, small amount. Apply it to the vulva daily and just see how it responds to you. Always do tell clients, just do a skin patch test on your inner arm, you know, the sensitive skin first, just to be sure before we go slathering it on. You know, don't want to use too much too soon, and just make sure that you don't have any reaction. Again, we are getting just tremendous results. Seriously, 99.9% good feedback. So I want to just encourage you to just give it a try. It's risk-free, and I just couldn't encourage you more just to get the word out. And if you yourself are like, oh, I'm not sure, get one for you, refer it, you know, and also refer your friends. So there's, again, it's low risk. It's a beautiful product. It smells good. It's a luxurious, really a luxurious formula. So, and to remember that you're taking good anti-aging care of your feminine bits down there. And that's so important.
That's great. Now you said that the tube is definitely, the full size is available internationally?
Yes.
Okay, that's good. I just wanted people who are listening, because we do have people from all over the place that listen to this. So, and definitely let other women know about this Facebook Live, because I feel like our main goal here is to inform people of the choices that they have. And there's just one thing, there's a lot of silence around these issues. And so just us having as many of these conversations as we can have, and really putting them out there so that women have access to them and see that this is not a shameful or embarrassing thing, or it's a normal thing, and it's happening to pretty much everybody, you know, that's out there, you know. So maybe it'll encourage people to start having conversations amongst themselves, and then to understand the different choices that are there. And this is, believe me, I've tried a lot of different things. I work with women, and so I try everything that I recommend. And I haven't found anything that's just so simple and so precise in its effects, and where I've, you know, felt completely at ease, you know, like no bad side effects or anything like that. So for me, I know it's been a real godsend. I'm like, wow, so I feel it's one of those things that I feel really, really confident about, you know, about offering, you know, in terms of the information and the free trial. So I know from my personal experience, I can completely back it up, and I don't put things out there that I don't feel that way about. So I just want to thank you. I don't know if there's anything last words you want to leave people with for now. I know this is an ongoing conversation.
Yeah, no, and I feel so grateful for you, because you are putting yourself out there. You're putting your personal story and your personal journey out there too, and experience. And that means so much. I mean, that's what makes you a leader in women's health. And I appreciate that in you. And I would encourage others listening today to really share this information. You don't know who is needing it. And I think it's good for us to get the conversation out. Again, you know, men have no problem with it, and we have solutions, and being able to share a good solution. And again, even with, you know, Catherine, with our full tube, we offer a 60-day money back guarantee. I mean, who offers that? Viagra doesn't offer that, right? And so, I just want women to know that there are options for them, and that they are important, and their feminine bits are important. And that's what I care to share, and just hope that this message reaches those people listening, that it makes a difference in their lives.
That's beautiful. I really, really appreciate that. So we'll say goodbye for now, and to be continued.
And I love your plants. I'm looking at that all the time, looking at your plants. Right. I'm like, oh, they're gorgeous.